After you have a baby, you start caring more about poop than you ever have in your life. You pay attention to the color and the consistency and the number of dirty diapers that your baby has. And a lot of parents want to know, well, what's normal and what's not? In the first few days following delivery, a baby stool will be tarry and kind of like army-greenish-black in color, and this is called meconium, and it's the stool that existed in their bowels before delivery. And this is what comes out afterwards. And then as they start to drink breast milk or formula, the color and the consistency begins to change. A breastfed baby will typically have like mustardy-yellow colored stools, and they'll be loose but not watery, and even have like little mustard seeds in it. And a formula-fed baby can have stool that's anywhere from brownish to yellowish to greenish, and that can all be normal. You might also notice that it changes color occasionally, and that's okay. You'll especially notice changes in the consistency, the color, and the odor when the baby starts eating more solid food. Now, there are some other colors that warrant a phone call to the pediatrician and sometimes even an exam so that the doctor can talk to you more specifically and decide if further investigation or treatment is necessary. The first is blood or red stools. The second is black stools. This is usually a sign of blood going through the intestinal tract. And the third is white stool. This needs to be reported to your doctor ASAP because it can be a sign of an underlying liver problem. And again, the doctor will help you sort out what it is and decide if anything needs to be done about it. Now, there are a couple of other things to watch out for. If your child has mucousy stool, also talk with the doctor about that. If they're having persistent diarrhea, one of the biggest concerns is dehydration. They're having more go out than what they're ingesting, and so especially small babies and young children can become dehydrated quickly. So call the pediatrician if this is an ongoing or very acute problem, and they'll give you tailored advice and information about what you need to do. Another very common issue is constipation. And if a child has to strain for 10 minutes or more without success, if they're passing unusually hard or pebbly stools, if they're having a little bit of bleeding when they're going because they're straining so much, then talk with your pediatrician about it. Their advice is going to depend on how old your baby is and how severe the case is, what home remedies you've tried and what you haven't. If you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.